Hello, my name's Florence. Welcome to theobspod. I'm an NHS obstetrician, hoping to share some thoughts and experiences about my working life. Perhaps you enjoy Call the Midwife, maybe birth fascinates you, or you're simply curious about what exactly an obstetrician is. You might be pregnant and preparing for birth. Perhaps you work in maternity and want to know what makes your obstetric colleagues tick, or you want some fresh ideas and inspiration. Whichever of these is the case, and for that matter, anyone else that's interested, the theobspod is for you. Episode 108, Running in Pregnancy and Postpartum. A chat with Megan James. Fantastic. Today I'm welcoming PhD student Megan James to the podcast, and we're going to talk a bit about exercise, in particular running in pregnancy and postpartum. And I came across Megan on Twitter, where she was sharing some of the work she'd been involved in, and also a current survey and questionnaire that she's involved in. And I was interested to have a bit of a think about the work she was doing. So welcome, Megan. It's lovely to have you here today. Can you tell people a little bit about yourself and how you got interested in this topic?
Yeah, so thanks for having me on to chat. So I first kind of did an undergraduate degree at Swansea University in sport and exercise science. And I got really interested in the kind of biomechanics, injury prevention kind of side of things. Obviously, like a lot of people get interested in like elite sport performance side of things, which I thought maybe when I went into it, that's what I'd do. But as I got to know more, I got really interested in kind of injury prevention and things like that. And just enjoyed doing lots of research towards the end of my third year. So that made me want to do a master's. So I then started a master's in sport and exercise science at Cardiff Met University. Again, kind of focused towards the biomechanics side of things. And started working quite closely with Dr. Izzy Moore, who supervised my master's dissertation. So I got quite involved with running at that point and kind of injury prevention in running specifically. And then worked quite closely with her on that in my dissertation. And then I actually, towards the end of my master's, got involved with a project with her where she started looking at the postpartum population and returning to running in that specific population, as well as some pregnancy-related things as well. And it kind of panned from there, where I just got quite interested in applying what I knew in biomechanics already and sports science into that area specifically and that population. So then it kind of just panned out that we worked together a little bit, and I was lucky enough to get an ESRC funded PhD, which I started in October at Cardiff Met. So I'm in kind of month 8 or 9 now. So yeah, it's going well. We'll just keep going.
So you're at the beginning of this journey.
Yeah.
And what are you hoping to find out or achieve, I guess, by doing your PhD?
So the kind of overarching kind of title that we went with when we proposed it was a kind of interdisciplinary approach to returning to running after childbirth. So kind of the idea that like returning to running or kind of childbirth as a concept should be viewed in the same way as any kind of musculoskeletal injury should, that needs to be rehabilitated. And it's not just something that happens and then you go, after a certain period of time, you're okay to start running again. Just with a view that it's something that needs to be targeted from multiple directions, whether it be kind of biomechanics, psychology, that needs to be addressed. Because there's so many changes that women go through during pregnancy and childbirth, similar to, if you have like a sporting injury.
Yes.
That should be addressed, and they're all individual to each person's kind of journey. So hopefully the kind of project is about 3 years or so. We're hoping to have kind of around 3 studies involved with that. And hopefully by the end of it, we might have something to kind of add to the literature base, in that we try and use some kind of return to running program that's kind of informed by the earlier studies we do, and see if it's effective or not in helping women get back into running.
Yes. Okay. So at the moment, you're trying to explore why people don't get back to it or what the problems are.
Yeah, so our kind of starting point, we kind of agreed, was that we should first actually ask the target population and the users of the intervention what actually kind of stops you returning to running, what things help you return to running, and what things would you like when you're trying to return to running. Because a lot of the time, I think, as researchers, we might not know, and there's not an awful lot of evidence on this population. It is starting to increase now. I think it's an area that's getting quite popular, so hopefully the work will complement some of the other stuff going on at the moment. So it's the first kind of step that we're going in is trying to find out what they need, what they think will help, and then just going into a little bit more detail about how we could kind of shape that and target different things in an intervention, obviously then using the kind of sports science theory that we have already.
Yeah, and so I saw your tweets and I thought it was really interesting because, theoretically I should know lots about exercise in pregnancy, being an obstetrician, but I really don't, and we don't do anything in our training about what advice to give women both antenatally or after they've had their babies. I mean, I guess that does overlap a bit with maybe physiotherapy more, but I have had women ask me, is it all right to run in pregnancy, or when can they start exercise again postnatally? And I mean, there's really very little advice out there. And I've even had women who've said helpful, and I say that slightly sarcastically, friends and family have been like, what are you doing running while you're pregnant, or running when you've just had a baby? And, given the population issues with obesity and general health, it just seems really bad that there's such a kind of lack of evidence or advice, which I think is what kind of drew me to your stuff. Like, someone's actually looking at this.
Yeah. Because there are so many health and fitness benefits associated with physical activity generally, and then running is one of the most accessible forms of activity because you can just go out and do it. And there's been a few reviews on the kind of advice and guidelines around physical activity generally during pregnancy and postpartum, and the consensus is that there's loads of inconsistency between countries, or just a lack of advice generally. But then in terms of running specifically, there's even less on that kind of area. And there's a bit of a stigma around running because it's a high impact activity. A lot of the time people will just say, just go and do some lower intensity stuff that isn't going to put you at risk. But generally, it's been said that it's considered safe during pregnancy and postpartum. Obviously postpartum you don't do it straight away, but there is guidance around that. But during pregnancy it is a safe form of exercise, just as long as you don't kind of fall into a few contraindication categories and things like that. And as long as you didn't not run before, it wouldn't be a great idea to start running during pregnancy when you hadn't before. But there's just this kind of taboo around it as a subject, and as you said, so many even in our research that I can talk to you about later, there's people quotes in our research that say things like, I feel guilty for going because so and so thinks I shouldn't, or things like that, where or they feel like they're not giving enough time, that they shouldn't be taking that me time because they're in a different role now.
And I was really so looking up when one of my patients asked me actually, and she was saying, I mean, she'd had a pregnancy complication, and one of her family was saying, it's because you went running. And I was like, whoa, absolutely not. And I found this lovely infographic, which presumably you've seen. I'll put it in the program notes, but this one, the physical activity for pregnant women and postpartum. And it says aim for 150 minutes of moderate intensity activity every week. And I'm looking at the women in my antenatal clinic thinking, I doubt very much that any of them know that is the actual guidance. And certainly as obstetricians and midwives, I don't think we're telling people that. And I know some of my colleagues, when they've been pregnant, have done, specific pregnancy fitness regimes and stuff like that. But we often tell women to walk or go swimming and do low impact stuff, like you're saying, but without any really good or reason. It's not good, really.
Yeah, and my argument is always, I feel like I repeat myself when people ask about it, but is if you got injured running and had a musculoskeletal injury, your healthcare professional or whoever wouldn't just say, just don't run again, just go and do something else. Yeah, after childbirth, people seem to go, just go and do something else. And it's like, why should that happen? Why should there not be just more research and evidence and advice going into this, instead of just brushing it off as not a big issue? And it also kind of encourages then that active lifestyle for the children if they're growing up in. So it's a very beneficial activity. It's one of the most accessible activities, but it just doesn't seem to get the attention, or it's, or the sample, the target population doesn't seem to get the attention it deserves. I do think that's starting to change, but obviously doing a PhD in an area with little research is sometimes challenging as well. But we've got to start somewhere, I suppose, and that's I've spoken to my supervisors and we've said, okay, we've got 3 years. We'll try and do something. Obviously, we're going to try and do something good, but it might be the case that it's a stepping stone, because there's so much that needs to be done. We're not going to do anything absolutely world changing with 3 years, but it hopefully will start complementing other work and kickstarting things in the right direction.
Yes, yeah. And when you're talking about, so you mentioned a bit about biomechanics, so I'm interested in that because biomechanics is a bit of a buzzword in the maternity world at the moment. How, kind of how you can manipulate your pelvis and exercises and things you can do in labour to try and get the baby in the right place and so on. But I kind of, at a basic level, I suppose I think, well, I know there's hormonal changes on your ligaments and joints. I know your centre of gravity is different. There's different pressure on your back. But I don't know a lot about the physiology and changes that means would happen in terms of your musculoskeletal system.
Yeah. So a lot of the focus of my PhD is, we've decided to kind of, at the moment anyway, things always change, but at the moment we're looking predominantly at the pelvis in terms of biomechanics, which is obviously not a surprise, just because of the kind of trauma that goes through the pelvic floor. It's one of the main, one of the, the main site, really, isn't it? And so we're kind of, the main thing we're looking at is loading on the pelvis. So obviously the stigma around running is that when you run, you hit the ground, and the ground reaction force, or that comes and shocks through the body, is then shocking the pelvis, and that's supposedly supposed to lead to pain or those kinds of things, basically increased loading. So one of the things that we're looking at is how we might kind of measure that on a kind of graded pathway of exercises, just to see between individuals or whatever how there are differences between them, and see how, when you're certain stages, how that looks, and maybe to see how, if you're doing X amount of running, how is yours compared to this person who's doing that much, or if you haven't returned, and just kind of looking at as well strategies that we can employ and movements that we can use to either change running technique, or kind of just other movements that get you ready to run but aren't actually running, or a little bit less intense, just to see if that reduces some of that load. Because there's a lot of stuff on kind of gait retraining and lower limb injuries, like with the tibia, you get a lot of work around like patellofemoral pain at the knee, and kind of stress fractures and stuff in the lower limb, measured with kind of things like ground reaction forces, tibial acceleration. But there's not a lot done further up on the pelvis. A lot of the time when people talk about things like shock attenuation, which is kind of absorbing the force from where you hit the ground through the body, it's often measured from the leg to the head, and nothing in between is thought about. And it's like there's a lot going on between those 2 points. And I know that obviously it's there can't be research on everything, but it is a bit of a gap in the literature. We don't know exactly from what's going on. And if you think about then, postpartum women, that's like the main sites where they've been through trauma. We don't know what's going on there. So a lot of my PhD is probably going to be quite exploratory and just looking at, okay, so what does this kind of look like? So it's going to be interesting, I think.
And with that, I guess there's also sort of as an obstetrician and gynecologist, there's the pelvic floor, and I know some women have said to me, they've had difficulty perhaps taking up running again because of continence or difficulty controlling their bladder. Is that something you've found in your kind of surveys and things so far?
Yeah, so we've done a couple of studies. One of the papers that we released, so the paper that we released first was, it was published in 2021 and in the BJSM, and it's called Multidisciplinary Biopsychosocial Factors Contributing to Return to Running and Running-Related Stress, Urinary Incontinence in Postpartum Women. And some of the things that we kind of looked into things and looked at, what are the factors that contribute to returning to running, but also returning to the same level of running as before pregnancy, because for a lot of people that's important. Like, it's one thing having just got back to running, but it's different getting back to where you were. And we kind of found that this was another survey study. We found that obviously running during pregnancy, a high weekly running volume, a low fear of movement, so kind of that psychological component, and not suffering from vaginal heaviness increased the odds of returning to running. Whereas a low weekly volume before pregnancy, having more than one child, a lower fear of movement and being younger, and a shorter time to their first run after childbirth increased the odds of returning to that pre-pregnancy level. And then we also looked at the kind of risk factors that affected stress, urinary incontinence, or likelihood of having postpartum running related specifically, so, experiencing during running. And we found that if they suffered from it pre or during pregnancy and had returns to running, they were more likely to have it. And if they had a cesarean delivery, they were less likely to. So there is that kind of debate around, like delivery modes and things. So that kind of gave us a little bit of ideas of things. That was like, the first kind of study that I was involved with anyway, that gave us some ideas of things that obviously need to be addressed in advice and things going forward. And then, we did a second and third paper following up to that, in the Journal of Women's Health Physical Therapy. I can give you links or whatever to these.
That would be great.
And so our part A looked at why women stop running during pregnancy and don't return to running during postpartum. And we found that things like morning sickness, fatigue, things like that, obviously like stop people running. And then kind of not returning was due to like symptoms or pain and postpartum complications. But also like women even who had returned were concerned about leaking urine, pelvic floor dysfunction, and it was just pelvic floor was just prevalent throughout pregnancy, postpartum, and people who'd returned and not returned. So it's one of the reasons I think why we're so focused on the pelvis in our work. But it just shows how much more evidence there is that's needed. And a lot of people said they were concerned they didn't know how to run safely afterwards. And we went on to do then a part B to that, which looked at kind of how advice affected their habits. One and we found that only 37% of women received any prenatal advice. 31% received kind of broad postpartum advice.
Yeah.
Which is not high, like 1 in 3-ish women.
Yeah,
And people are runners. So,
yeah. I'm sad to say that I'm not that surprised that people are not getting that advice, because I'm thinking the midwives and doctors they're seeing probably don't have the knowledge. And physios who might have the knowledge are just spread so thin. I mean, to have a women's health physio is, it's difficult. So I can see that there's that massive gap potentially in advice.
Yeah. And, and the thing, like one of the most important things we found in that paper as well was that kind of having received any kind of broadly sourced running advice, postpartum was related to them having returned. So those who actually got advice had returned.
Right.
And then kind of there's, I should mention there's been released, I think it was 2020, clinical guidelines, which are the first kind of return to running guidelines released by a team of physiotherapists, Tom Goom, Gronya Donnelly and Emma Brockwell, and they've released them as the first kind of return to running clinical guidelines based on like clinical opinion. And they emphasize that they know themselves that it needs to be evidence backed, but this is kind of our best, to the best of our knowledge, what we would recommend based on the literature, the limited literature that's out there. And we looked at kind of if people were aware of these guidelines as well as kind of generally what's out there. And women who were aware of those guidelines, I think it was 94% found them useful out of the women who'd seen them.
Wow.
And those who actually had read them took longer to return to running, which we actually were surprised by at first, but then thought, actually, are they just being more cautious and informed in their return? So we just thought like that paper as well just highlights how important it is to get advice to be more accessible, and also that it just needs to be individualized and specific to people as well. Like, because there are so many, I know it's impossible to do it to every single person, but when there are so many factors to think about, delivery mode, age, number of children, or like loads of different things that might affect how women recover, there just needs to be so much more, basically.
But even a start about women or the healthcare professionals looking after them, knowing there is some guidance, and publicising that guidance and people finding that guidance useful is a start, isn't it?
100%. Yeah, that's one of the things we said, I think, was that it needs to even like, as well as women being educated, everyone needs to be educated.
And that's kind of why I thought it'd be good to get you on the podcast, because I know quite a lot of midwives and obstetricians listen, as well as pregnant or women or new mums. And so actually, if you can give me the links to some of these things, then hopefully that might disseminate things a little bit more.
Yeah, of course. Yeah, like that's the thing. It's like bridging that gap as well between academia and practice, isn't it? Because some even though there's limited research, if there is some, it's maybe not getting into the kind of where it needs to be used.
I think they say it's something like 7 years or more, isn't it, from something being discovered to actually being implemented, minimum.
Yeah, probably. And I think as part of my PhD, one of my supervisors as well is kind of very big on public health, and I think part of the PhD will be, okay, we can find something out that might be useful or not. Even if it's unsuccessful, it'll be good because people will know it doesn't work as much as anything else. But okay, we can find out whatever, but we need to be able to disseminate it effectively, otherwise there's no point. And I think part of the PhD will be working with the target population to talk about how best can we get this information to you, because if we can't get this information to you, it's not that worthwhile in the end. obviously it adds to the literature base, but we want it to get to people it's going to help. And hopefully with some of the things that we're looking at doing and trying to see if things work, we're hoping to have kind of measures that people could maybe do themselves, that make it more accessible, rather than saying, well, you're going to have to come into the lab with us. But we'll have to see how it goes.
No, that's really good. So I know you've got an e-survey out at the moment. Do you want to talk a little bit about that?
So our study one, as I kind of briefly mentioned earlier, is trying to figure out what helps and hinders women returning to running, and what could help them, or what they would like to help them return to running, so that we can then later on target those specific things with an intervention or return to running program to try and actually address their needs. So it's basically for anybody who's over 18, gave birth in the last 2 years and ran for at least 30 minutes before their most recent pregnancy. It's about a 10 to 15 minute e-survey. It asks a bit of descriptive and demographic information and kind of history first, just to see kind of what people we have answering, and if we can link things to things. And then it specifically asks those questions of what helped you, what hindered you, what would you like to help. And if anyone responds, if you could just give as much detail as possible so that we can help you. And it'll hopefully just help us understand what we need to look at. And the link is on my Twitter page. I've retweeted it so many times. So my Twitter handle's at MeganLJames16. But obviously if you want to tag me you can see it, that's fine. And there's a link on there to the e-survey. So if anybody is eligible who's listening, or if you know people who are eligible, please feel free to pass it on, because as many people as we can get, because people are so different. Looking at all corners of the population will be the most beneficial.
And how many people are you hoping to get answered? Have a kind of number in mind?
Yeah, we were kind of going for about 500. So the papers we released before had about 800, nearly 900. We're hoping about 500 for mine. I think we're currently around the 220 mark. So we're getting there. It just
takes a bit of time. Excellent. Oh, that's really good. And I can definitely put that link in the program notes for people to share. That'd be really, really good, I guess. Anything you think that we haven't talked about that would be good to discuss?
It's just about getting that word out to everyone, I suppose, as you were saying, and working together with clinicians and academics. When we published these papers, we had Gronya Donnelly on our team, Emma Brockwell, Joe Perkins, who were all kind of physiotherapists, pelvic health physiotherapists. And it really helped that, because my background I'm not a physiotherapist. I don't pretend to be one. There are people who know a lot more than me about pregnancy and things like that. But it's about working together to kind of use each other's knowledge and bridge those gaps. Just hopefully it'll start putting us on the right track, and it's just quite an exciting area to be working in. So and rewarding as well.
It sounds like it, and it sounds like it's work that's really needed, and that I accept within your PhD you might not it might just be the foundation and the stepping stone, but my goodness, it could bring really big change or benefit in the long run, couldn't it? If actually more women were able to safely get back to running, or encouraged to be running both during pregnancy and after having their babies.
Yeah, exactly. And it's it's one of those sports as well that it's accessible, but it's also what a lot of people do to keep fit for their main sports if they're not runners. If you're like a netball player, hockey player, you'll go running to keep fit. So it's all it's a bit of I think a lot of people would make sure they're back running before they went back to those sports.
Totally. My daughter plays football, and she runs to keep fit, and also in the off season. so that when it's pre-season and she's getting back into it, she's ready because she's been running all through the summer. So yeah, very much it's kind of something that people use to maintain their fitness for something else as well, isn't it?
Yeah, definitely. Yeah.
Yeah. Oh, well, thank you very much. That's been really interesting. And I wish you lots of luck with it. And
thank you.
And I look forward to seeing amazing things happen. But that's really great. Thank you.
No problem. Thank you so much for having me on.
Let's think, what's the zesty bit from that fabulous conversation with Megan? I guess a couple of things. One would be, please, 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 if you fit her criteria, you're over 18 and you've had a baby in the last couple of years and you're a runner, fill up her survey. And if you're a maternity professional, try and disseminate it to women who might be able to fill up the survey. But on a practical note, if you look in the show notes, I've put the guidance that she mentioned, and there's some really great information in it, both for women themselves and for physios, GPs, midwives, health professionals caring for women in the postnatal period. There's a really great appendix flowchart on how to assess women and whether they're ready to resume running, as well as an appendix on exercise progression for those first few months postnatal that would help you build up and get ready to restart running. So check out the guidance, check out Megan's links and answer her survey if you possibly can, so that we can help progress this fascinating area and support women's health and women's exercise in the future with better quality information and advice. I very much hope you found this episode of the theobspod interesting. If you have, it'd be fantastic if you could subscribe, rate and review on whatever platform you find your podcasts, as well as recommending the theobspod to anyone you think might find it interesting. There's also tons of episodes to explore in my back catalogue, from clinical topics, my career and journey as an obstetrician, and life in the NHS more generally. I'd like to assure women I care for that I take confidentiality very seriously and take great care not to use any patient identifiable information unless I have expressly asked the permission of the person involved on that rare occasion when it's been absolutely necessary. If you found this episode interesting and want to explore the subject a little more deeply, don't forget to take a look at the programme notes where I've attached some links. If you want to get in touch to suggest topics for future episodes, you can find me at theobspod on Twitter and Instagram, and you can email me theobspod@gmail.com. Thank you for listening.